So you want to be a nurse, huh? Get your coffee, your tea, whatever it is you're going to have, because we're going to get started here at Life Cafe. So you want to be a nurse. What does that mean? Well, that means there's a lot of things you have to know. And because it is Nurses Day this year is May 6th. So shout out to all the nurses and all the healthcare professionals that are out there right now, especially right now with all this that is going on. I am so proud to have beautiful, beautiful peers of nurses that are so brave and that are true heroes. We are not just angels of mercy or whatever you guys call us. We are true heroes. So now let me tell you, I'm not working at the time, but I am looking on volunteering some time, maybe from home, to be able to in some way give back to everything that's happening. So I know there's a way that, we can work from home, and that's the best way to do it if you can. But a shout out to those nurses that are on the front lines, that are taking care of all the patients during this time that is a very difficult time right now. So let's get on with the show. Is this a show? I don't know. So let me tell you, back in the times, in the old days, nurses were thought of as handmaidens, I guess is what they were called. Thought of as maids, I guess, and even some doctors, some older, like boomer doctors, would tend to say things like, hey, handmaiden or maid or whatever. That's how they used to think of it, and everything evolved and changed, and nursing has come a long way. So if you're looking to get into nursing, this is the video for you. Now, I had made a long time ago, I made a video that was very popular. I had to take it down because it was very controversial, but now I'm updating this video. And so I want to tell you some of the things, like what do you do as a nurse all day? Because I think it's just not just for nursing students, but everyone in general. Because when you go to the doctor or to the hospitals, I think a lot of times people really don't understand what we do. And so that is a really kind of misconception, that we're just there flipping through our magazines and then our nurse's station or what have you, and just giving shots all day. And that's not what we do. That's not at all what we do. So yes, giving medications is one of those things that you must do as a nurse, of course. That is a vital function part of it, but it's not all of it. And when I went to school, the professor used to say, you don't get paid for what you do. You get paid to think. You get paid for what you know. And that is very true. So, from the layman's point of view, layman's terms, a lot of times you guys have family members in the hospital, or you yourselves, you're in the hospital, and you're thinking, what is that nurse doing all day? Where is the nurse? Oh, nurse. And every time you see someone go by the door, you're like, nurse, nurse. Or you're just clicking away at that call light, the call button, and pushing away for someone to help you. And you get frustrated because the nurses don't come as fast as you want them to. Let me tell you, they are not congregating in the station nursing lounge, just drinking coffee all day and reading magazines. Trust me. There is hardly ever time to even go to the bathroom at times on some days. So what do we do all day other than giving medications and shots and things like that? Well, let's see. I have a little list that I made here, a little cheat sheet on some of the things I remember I did. Now, like I said, I haven't been working for a while now, so things have changed a little bit in the hospital. But some of the things that I did, other than just give medication, but with medication comes a lot of things. You cannot just give a medication. You kind of have to look at the whole picture of your patient. So you get your 5, 6, 7, whatever patients you have nowadays, and you must know what medication you're giving, the symptoms, the adverse reactions of that drug. And if you don't know it, you have to go look it up. You have to maybe concur with other peer nurses or your supervisors and see what kind of things you're looking for. I'll give you a quick example. This is just a really quick one. Is that if you have patients with high blood pressure, which a lot of times we do, then you have to know what that patient's blood pressure is before you give that medication. You can't just say blindly, oh, the doctor ordered this medication for blood pressure, boom, let's go ahead and give it. Because you're going to run into a lot of problems. What happens if you're giving that medication and the patient is already dropped their blood pressure really low for whatever medical reason, and there you go giving them more blood pressure medication that is going to cause their blood pressure to even drop even further. So it's kind of like a stop and think kind of thing with every drug, with every patient, every hour. So that is a lot to be thinking all day, every day. So we're not just there like staring away into space. We're actually thinking about stuff when you're going by, when you're seeing the nurses go by, you know, they're in a rush and they come in and all you feel like is that they're just coming in to give you your pain pills, your medications, your blood pressure meds, whatever, and then they're off the door. But that's not at all what we're doing. So we're thinking about those drug interactions. We also have to come back and assess to see how you did with that medication, because a lot of times you might have an adverse reaction, or maybe if it's a pain medicine, maybe it didn't work and you're still crying in pain. So that's another assessment that we have to come back and do. Also, we have to call the pharmacy, because if we're out of that medication, we need to hunt down the pharmacy and ask where's the medication. Maybe they can deliver it. Maybe you have to go get it yourself if it's something that's really urgent. And also you have to check for allergies, you know, make sure this patient is not allergic to medications. There's been plenty of times that I have seen people caught off guard and that allergy was not checked. So that's really, really priority to do that. Make sure that patients are not having, you know, your 5 rights: right time, right patient, right drug, all that stuff that you guys, nursing students, will probably know what I'm talking about, and nurses, of course. But anyway, so we're calling the doctors as well. We're calling to the doctors for advice, or for new orders, or for clarifications that we may not understand, or changes in status of the patient. Maybe the patient is spiraling down and you need to get new orders. Sometimes you have to give those orders yourself and then get it okay by the doctor after. But that only happens in some instances, and it's usually done like in the emergency room. When I was an ER nurse, that's what we have to do that. That's what we had to do then, there. So we're also getting consultations from other doctors that need to come and consult. Maybe you need a GI specialist, a stomach doctor, psych eval, I don't know, whatever it is, we have to call and get those doctors to come in. We have to call for the test results on your test and also get you prepared for the test. Maybe we're going to give you some kind of solution you have to drink before a test, and then we have to call X-ray to come and pick you up. Not to mention if there's a new admission with all this going on. New admits, you know, nurses, you guys know what I'm talking about. You have those new admissions or discharge patients that are being discharged on maybe less than an hour to your shift, and you're like, oh my God, OMG. Because that takes quite a while to do. Especially during shift change, that is horrible. Because there is quite a lot to do. When you're admitting a patient, you are receiving the patient, you're getting a report from that nurse that is bringing the patient, either by phone or when they're bringing the patient over. You are also getting their new orders ready. Maybe you have to call the doctor for clarification and, you know, go through the whole history, make your own nursing assessment. So that all takes time. And, you know, giving the medication and then going to shift change. So that is a lot. And also the same thing for discharging. You know, you have to disconnect the patient from all kinds of tubings, and if they're going home, you need to arrange for them to go and get a wheelchair if they have to, you know, leave the hospital and get their belongings together. Call if they have something, you know, put away in the safe or something, we have to call for them to bring it. Patient discharge instructions, explaining the instructions, charting, closing the chart out, and things like that. So it is a lot to do when it's an admit or discharge. Not to mention if you have to pick up blood transfusions, if you're doing a blood transfusion, you have to have a witness of the blood you're giving, and also checking for if you're giving any narcotics, morphine, then you have to have a second witness for that. So there is a lot of stuff going on. Like charting is like editing for YouTube. Let me tell you. Anyway, for me, I don't know if you guys are nurses and you guys are watching this video, tell me if you feel the same way, because charting to me is like one of those things like like with the editing, but it must be done, especially in nursing, because This is what's going to save you, as a nurse or doctor or healthcare professional with a license. You have a responsibility, but also a liability. So if you don't carry insurance or what have you, you probably should, because although let me tell you, there's something that I always remember our instructors telling us. Oh my God, how long is this video? The instructor would say, if you have a good attitude, the patient will like you and nobody will ever sue you. Now, that's not always the case, but it is the majority of the time. If the patient likes you, they're more likely to forgive you for whatever mistakes, or if you forget something, uh, because they like you. So that's pretty much a general rule for in life in general for anything. But yeah, charting is something that must be done, and you have to document it all. If that patient, let me give you an example. If that patient is, I don't know, if they're farting or whatever while passing flatus, let's use the right terms, then you have to document that, especially if they're having GI problems or what have you, stomach problems. But then you have to do rounds with the doctors. The doctors come over, they talk to you, they're looking for the nurse. You have to go with them to do your rounds with them to check on the patients, give them an update status on the patient, and things like that. And if you have patients on a vent, that's a big one, because you definitely have to be, a lot of times you will only have that in the ICU, but a lot of times as an ER nurse, I had some patients there in the ER as well, but also in the med-surg floor and the cardiac units. You can have vent patients in pretty much any unit, but until they get transferred over to the ICU. So that is a critical patient that you need to have. Not to mention if you have another patient that's going into respiratory distress, and you have to call the respiratory therapy or therapist, and so it is a lot. RT for short, respiratory therapist. But so pretty much, as you could see, this is kind of looking like a multidisciplinary approach. I can't even talk today, oh my gosh. So this is pretty much a multidisciplinary approach, because it's like you have all these people around the patient that are working in tandem to assist the patient, to help the patient. But the nurse is really, it's kind of like a circle. You have a circle, but in the middle, the nurse is the one in the middle, and everyone else is circling around the circle. So the nurse, you will be responsible for making sure that that patient gets their medication, that the patient gets to the right department where they need to go, whether it be radiology, whether they're having an x-ray, whether they're having blood work and that lab technician hasn't made it up. You need to call and figure out what's going on. You need to get test results. You need to get the labs done to see if they're high or they're low. Are they normal? If they're high or low, you have to contact the doctor, get an okay to administer medication or new orders on medications. So as you can see, there's a lot of thinking, a lot of things to do. It's not just, okay, I'm just going to give the medicine and follow doctor's orders. When I first became when I first became a nursing student, that's really even a misconception that I had. I didn't know like how much this is our own practice. We don't work for the doctor. We work with the doctor. And a lot of times as a nurse, you can refuse to give any type of treatment to patients if it's not in the best interest of the patient. And that's where you also have to become their strongest advocate, because you want to make sure that you always keep number one is the patient safety. So of course, with patient safety comes in to make sure you always check their ID. If there's nothing else you take from this video, please take this to heart. Number one rule, always, always, I don't care how old you have been a nurse. If you're an older nurse, I don't care if you're a young nurse, older nurse, you have done this for years. Never, never, ever give medication without checking the patient's ID band first. Always. No exceptions. So trust me on that. I've seen many things. I've never made that mistake. Thank God. Thank you, God. But I've seen things happen. So please make sure, or almost happen. So please be sure that you always check your patient's ID band. Make sure with them that it is them. Check date of birth, all that stuff. So let's see what else I have here. Supervisors meetings. God, I wonder if those are still happening. We used to call them supervisor meetings. What? And I'm sorry if you guys are nursing supervisors out there, but and I'm not saying all the meetings are like that, but some meetings were really like, oh my God, seriously? It's like, I have a patient that is in respiratory distress. I have another one that just had an MI, which is a heart attack, myocardial infarction. And you're calling me into a supervisor's meeting for all the nurses to attend so you can teach me how to wash my hands? Seriously? I think that was our first nursing skill that we did as a nursing student. So why in God's name would you call me into that meeting to teach me how to wash my hands? We've already learned that skill a long time ago. So I don't know. It's just that's why we called it, and not just me, but we called it the stupid advisors meetings. But some of the meetings were good, I have to say. So not all of them, but that's what I mean when I say you have to strongly advocate for your patient, because if not, you will be in there listening to something you've already been through about washing your hands when your patient could die while you're out of the room because they're going into respiratory distress. So you really have to stand up for yourself and for your patient. There is a lot of liability involved. So make sure that you take care of that. And okay, so guys, this is getting to be a long video and I have a lot of more stuff, but if you want to see another part to this video, I will be happy to do one. But otherwise, the only other thing I want to share is like a lot of times there's so much, you will never have the same day twice. As a nurse, you will always see different things, doctors too, but since it's, nurses day, I'm focusing on nurses. But and a shout out to those health professionals that are not doctors or nurses. I want to shout out to you guys too, even though it's Nurses Day, because I think a lot of times you get forgotten. And like those X-ray technicians, the technicians, the transporters, the people that transport the patients to the laboratory, wherever it is they need to go to another unit. Shout out to you guys, because you guys do a very important job too. And I think sometimes people tend to forget them, but they are crucial to everything, including those dietitians, the people that, even the cleaners, the people that are cleaning the floors, the units, and the people that are coming to sanitize the areas. Everybody, a shout out to you guys. But anyway, so as a nurse, you also have to do daily things that are not daily, if that makes sense. So for example, you might have a patient with an open wound and you need to change their dressings every day for the time that you're there. So, but you might not have another patient like that the next day, or they might get transferred. So every day you're facing different things, you're assessing different things. You're speaking with family members, you're speaking to doctors, everyone, dietitians, respiratory PT, which is physical therapy, OT, which is occupational therapy, pharmacists, other nurses admitting patients to your floor, or you're giving report to them to discharge them or to another floor, or discharging them from the hospital. There's so much. So consults from other doctors that come in and you requested a consult. So, a lot of times when you see the nurses there congregating in the nurses station and you see them sitting down with charts and they look like they're just maybe looking through a magazine or something, it's not that. They are waiting for your doctor to call back because you put in a call for them to call back for lab results. Maybe your blood work is abnormal. Maybe you need medication because the one that you have is not working and they need to increase your dose. So there is a lot of stuff that is going on behind the scenes that you guys don't get to see as a patient. And so when we come in and you're mad because, it's been a little while since you called, and it's things like maybe you just needed a pillow. And this is what patients, unfortunately, this is what they remember the most. They remember and love the CNAs, the certified nurse assistants, because they bring them a pillow. They bring them comfort. This is what the patients want. They bring them the pillows. They bring them the warm blankets. They bring them the assistance to taking them to the bathroom, the activities of daily living, ADL. So they get help with that. And they conversate with them. And that's one of the beautiful things that I really loved as a nurse when I was a nursing student. I really had the time to do that, and I really missed it when I became an actual nurse, because I realized that when you become a nurse, you can't be their friend for the patient. You cannot be a friend. You have to be their nurse. And so it's a difference. And so I really did miss that part. But I learned quickly that in order to be an effective time management person in nursing, I needed to change. And so I needed to step up my game and really concentrate on what was best for the patient, regardless of what they thought or liked me or not. So that is what you have to do as a nurse. You have to advocate for your patient, make sure you're doing everything you can for them, thinking about what they need all the time, charting appropriately, and not worried about if the patient's going to like you or not. Now, you do have to be, I mean, you're not going to be rude and nasty and stuff like that, but you do have to take the time to maybe explain to the patient, okay, I need to go for a bit. If you need anything, please let my nursing assistant know that you need anything. If you need things like a pillow, I would always explain to my patients, if you need, this is a nursing assistant's name up here on the board, because you do, well, when I worked, they had a little board. I think now, I don't know how they do it now, but anyway, and I think the patients have, I think some hospitals, or maybe it's all hospitals now, I don't know, have computers in every patient's room, because that's another thing. We used to have to fight for blood pressure machines, but I think now they're in the rooms. It was horrible. I mean, the machine could be in another unit, and we could only find 1 or 2 blood pressure machines at the end of each hallway in the unit, and it was horrible because if you have a patient that needed their blood pressure checked and you needed to give that medication and you couldn't find the machine, it was terrible. So I learned quickly to bring my own stethoscope, my own sphygmometer, everything. The BP cuff is what it's called, blood pressure cuff, so you could understand, but it was a mess. So it's a lot easier now, I think, but it is a lot, and you do have to just know what you're getting into and really love it. And just explain to your patient, this is a CNA and this is what she'll do. She could bring you blankets, she can bring you pillows, water, ice, things like that you may need, and I will be providing medications for you, your dressing changes, your IVs, talking to the doctor. If you have pain, let me know, things like that. So it's basically, when you see the nurses out there, they're thinking and they're calling and they're waiting for calls and they're getting your services coordinated that you need for the day. So they're not just congregating there. And if they're talking to each other, they're not always, the majority of the time, they're not there just socializing. They are actually coordinating your care. Maybe they're giving off report. That's another thing I didn't mention, report. You have to give report for every patient at the end of every shift. So that could take a little bit. I think now they have it where you round with the nurse that you're going to hand the patient off to, and you go together to the rooms, which I personally like the best. But because you get to see the patient in action there instead of just sitting at a desk, telling them about the patient, you can actually take the nurse and show the patient that you're handing off, and you could actually see everything what's going on, and the patient can also hear what's going on and be in the know of everything. So that is pretty much it as far as, so you want to be a nurse, huh? If you still want to be a nurse, a shout out to you guys, and like this video if you guys want to see more, and share this video if you guys want to see more, and leave a comment. I love comments. That's another thing, not comments. That's another thing, for nurses. The best thing you can ever do is just thank them. And you don't have to thank them every time, but especially now during this time, especially those that are working in the front lines right now, the best thing you can do for them is leave them a thank you, because that is our bread and butter. That is what we thrive off of, and this is what really we enjoy, and it makes everything worth doing what we do. So that is definitely something that I love to do when I see nurses, even as a nurse. And just like YouTubers, as YouTubers, our bread and butter, it's other than money. And I don't do this for money, just to be clear, and a lot of us don't. We just do it to soothe the soul, and our bread and butter is to get these comments. We really enjoy the comments, and that's what keeps us going and keeps us motivated to make more videos. Same thing with nursing. That's what keeps us motivated when we have somebody that maybe came in a bad mood, a doctor, another nurse, whoever it was, and kind of, I don't know, I don't want to say it, but shit on our parade or something. We're having a good day, but this is what makes it all worth doing. Even if somebody else comes and tries to, get us in a bad mood, they can't, because we are doing a good job, and we have patients that appreciate that, people that appreciate that, and some doctors are really nice too. They will appreciate that. Their supervisors, there's a lot of people, so it's not always like negative, but it's more positive. So I hope you guys, if you are considering this profession, really do consider it, because it is a really good one. And there's so many opportunities out there that you don't even know. Like when you graduate nursing school, it's like you've only scratched the surface. So there's a lot to be done. So more power to you if you guys want to do it. And for those of you that don't want to do it and just wanted to see this video, thank you so much for hanging with me until the end here. If you did, raise your hand, say, here, I made it to the end. But thank you guys so much for watching. Remember to be healthy, well, happy, and organized. Many blessings. And again, happy Nurses Day to all the nurses, and a shout out to all the healthcare professionals in the front lines. And let's include all those essential workers too, because they are a crucial part to our world right now. So thank you guys, many blessings, and stay tuned for many more videos coming up.